Hello? Have you ever lost someone due to dementia or Alzheimer's? Or has someone you care about drifted off the path or, worse, is unable to recognize you? You see, if you love someone with dementia, you are also living with it. It affects not just the individual with the condition, but also everyone around them. Whether you're worried about yourself or someone you care about, knowing the most frequent warning signs of dementia might help you get an early diagnosis and perhaps avoid it. In today's video, we'll look at some of the most prevalent early signs of dementia and what to do if you see them. I encourage you to watch the whole video because it may help you save a loved one's life. Moreover, the later part of this video focuses on the possible solutions to this problem, so you wouldn't want to miss that. For the sake of this video, you must realize that dementia is not a natural part of the aging process. Even though about 40% of persons over the age of 65 suffer from memory loss, it's not a single disorder. It refers to a wide range of degenerative brain illnesses, including Alzheimer's, Parkinson's, Lewy body dementia, vascular dementia, and frontotemporal disorders. These illnesses harm cells that perform vital tasks throughout the brain, neurological system, and body. As the illness advances, the likelihood of developing life-threatening complications increases. Let's discuss the early indicators of dementia. Number 1, minimal short-term memory loss. Do you or someone you know tend to forget things or struggle to recall new information? If you're experiencing memory issues, this might be an early sign of dementia. The alterations are often minor and affect short-term memory. A person with dementia may recall events from years past, but not what they ate for the morning. One of the most prevalent symptoms of dementia or Alzheimer's disease, particularly in its early stages, is forgetting previously acquired knowledge. Others include forgetting key dates or events, asking the same questions over and again, and increasingly relying on memory aids such as reminder notes or technological devices, as well as family members, for tasks they used to perform independently. Dementia can cause short-term memory changes, including forgetting where items are placed, difficulty remembering why they entered a room, forgetting daily tasks, and difficulty finishing tasks. For example, forgetting to turn off the oven after cooking. Number 2, changes in mood. Are you or someone you know displaying extreme mood changes? Dementia is also characterized by mood changes. If you have dementia, you may not be able to detect this change in yourself, but you may observe it in others. Depression, for example, is prevalent in the early stages of dementia. Someone with dementia may also seem more afraid or worried than previously. They may get easily disturbed if their normal daily routine changes or if they find themselves in strange surroundings. Along with mood changes, you may notice a difference in personality. Number 3, challenges with new words while writing or speaking. Are you or someone you know forgetting words or replacing terms that aren't appropriate for a conversation? People with Alzheimer's disease or other forms of dementia may struggle to follow or participate in conversations. They may pause during a discussion and not know how to proceed, or they may repeat themselves. Another early sign of dementia is trouble conveying ideas. A person with dementia may struggle to describe something or find the correct words to express themselves. They may also halt amid a phrase, unsure how to proceed. Conversations with people who have dementia may be difficult, and it may take them longer than normal to articulate their ideas or emotions. Before we continue, PLS take a moment to like this video and share it with others so they too can benefit from it. Let's continue. Number 4, apathy. Are you or someone you know losing interest in friends, family, and leisure activities? Apathy, or lethargy, is a typical sign of early dementia. A person with dementia may lose interest in hobbies or activities that they formerly enjoyed. They may no longer desire to go out or have fun. They may also lose interest in spending time with friends and family and seem emotionally unresponsive. Number 5, difficulties in planning or addressing difficulties. Are you or someone you know forgetting how to do a common routine or chore, such as cooking a meal or getting dressed? Some persons who are experiencing memory loss as a result of Alzheimer's or other dementias may notice changes in their ability to form and implement plans or deal with numbers. They may have difficulty following a known recipe or keeping track of their monthly expenditures. They may have difficulties focusing and take substantially longer to complete tasks than they did before. Another potential early warning sign of dementia is a modest decline in the ability to conduct daily chores. Dementia may cause trouble with complicated activities such as bill tracking, recipe following, and gameplay. Additionally, individuals with dementia may struggle with learning new things or adhering to new habits. Number 6. Confusion. Someone in the early stages of dementia may often get confused. People with Alzheimer's disease or other forms of dementia may lose track of dates, seasons, and time. They may have difficulty comprehending anything if it does not occur promptly. They may forget where they are or how they got there. They may have difficulty recalling faces, recognizing what day or month it is, or determining where they are. Confusion may develop for a variety of causes and circumstances. For example, people may lose their vehicle keys, forget what happens next in the day, or have trouble remembering someone they just met. Number 7. A deteriorating sense of direction. Are you or someone you know having trouble seeing things clearly? Or coordinating visual and spatial data? Dementia may impair a person's sense of direction and spatial orientation. They may struggle to recognize familiar landmarks and forget how to go to locations they used to know. It may also become more difficult to follow a set of directions or step-by-step instructions. Before looking at some possible solutions, let's still consider some other common symptoms of dementia that are always taken for granted. Number 8. Difficulty adjusting to change. For someone in the early stages of dementia, the experience might be frightening. Suddenly, they can't recall who they know or understand what others say. They can't recall why they went to the store and might get lost on the way home. Because of this, individuals may want regularity and be hesitant to attempt new things. Difficulty adjusting to change is a common characteristic of early dementia. Number 9. Poor or impaired judgment. Are you or someone you know failing to recognize anything that might jeopardize their health and safety? Another effect of cognitive deterioration is the loss of decision-making capacity. For example, a dementia patient may be unable to notice risky conditions. They may attempt to cross a busy street without waiting until it is safe, or they may go outdoors dressed in summer attire while it is snowing. Another sign of poor judgment with dementia is the inability to make sound financial decisions. Someone who was previously frugal may begin donating money to persons or causes they are unfamiliar with. Number 10. Misplacing items. Are you or someone you know placing items where they shouldn't be? Anyone may briefly lose their wallet or keys. However, a person with dementia may store items in unsuitable locations. For example, place an iron in the fridge or a wristwatch in the sugar bowl. Forgetfulness and memory issues may not always indicate dementia. Memory lapses are a normal part of aging, but they may also be caused by weariness, lack of attention, multitasking, and nutritional inadequacies. However, if you or someone you know has dementia symptoms that aren't improving or are worsening, see a doctor. Neurologists may request memory and mental health tests, neurological exams, blood testing, and brain imaging. Dementia is most frequent in those over the age of 65, although it may also affect persons in their 30s, 40s, and 50s. With proper treatment and early detection, you may be able to delay the course of dementia and keep mental function for an extended length of time. Medication, cognitive training, and therapy are some of the possible therapies. Have you ever experienced some of these symptoms? Or have you noticed them in the lives of your loved ones? It's more difficult living with someone suffering from dementia. Kindly tell us about your experience in the comments section. Before you go, remember to like and subscribe. Thanks for watching. See you in our next video.